This is Denise Marley, who's a practice development nurse, and Janet Thomas, who's a healthcare assistant at Milton Keynes General Hospital. And they were both involved in developing and learning on a new dementia training programme. So we're going to talk to them both about their experiences of the course and what difference it's made to their care and their professional development. So Denise first, can I ask you, what difference does a course that's developed for learning on the job or learning at work make for clinicians who are looking after patients?
It was very much this course is designed by the Open University for it's an uncredited course which people can work on within the hospital, and then we set up some contact days where everybody who was on the course came back and we managed with them exactly what they needed to know to be able to facilitate their learning. So it was about, they would go and review a couple of the chapters, look at the knowledge that they'd got, and then we would come back into the classroom and discuss what people had learned. And we found that as a group a lot of people had different experiences which worked well to have further discussion from.
This was a course for healthcare assistants.
It is. We used it for healthcare assistants, but it does not necessarily have to be for healthcare assistants.
Okay, and in this instance about 50?
We had 50 of our healthcare assistants on the course for over 4 months, and over the 4 months we had contact sessions 4 times.
Now Janet, you did the course,
yes,
and you were one of the first graduates.
Yes, I did.
Tell me what your experiences of the course were, why you did it, and how you think you've turned out.
Okay. Initially, when the course was being introduced to the stroke unit and to all the HCAs in the Milton Keynes Hospital, I was excited about it. Oh, this is another way of me improving to learn more about dementia, because I usually see them differently. But after the course, now I have a very, very wide-broadening idea about how dementia is being treated and how you can care for them. And with the course, it has helped me, and it has also helped me to improve as well with the way I look at the patients with dementia and the way I treat them as well. And it has given me time to be able to study them and to be able to give them time as well to be able to care for them and to give them the quality care as well.
Did all the healthcare assistant colleagues of yours do the course at the same time?
Yes, we all did it at the same time.
And what difference do you think that makes, having colleagues all learning the same thing together?
Yes, it was challenging at the beginning, but we all get together because, like, if you don't understand anything, the practice development, they are there. We go to them, we speak to them, and they just advise us on what to do. Like that, and we have Tracy Davis, the lead dementia nurse as well, which she comes in and she talks to us as well with John White as well, which they also encourage us with the course, and at the end we all put through with it, and we show it as well on the ward and the way we care for our patients.
Denise, tell me about the content of the course. What sort of things are the healthcare assistants learning?
They learned about the different types of dementia and the sort of different sort of patients that they would come across. But one of the big things that they learned was that you couldn't nurse every patient with dementia the same way. It was about taking each patient as an individual, looking at what their needs were and how we could then match what they needed with that. And also a lot of it was about involving the families to find out what these patients are like at home, what is normal for their routine, how they like the tea, what sort of things they really love to eat, and just how we could then match what the care we were providing to how they get looked after in their own home.
And Janet, tell me what the next stage is, because you completed the course, you are one of the first graduates. What next?
The next stage for me, actually, because I want to further more in my career, just to go a little bit. I want to become a nurse as well, and which I think I'm in the process of that as well, which is going on, because the hospital, they've I think they are funding some HCAs for their nursing, which I've applied as well, and luckily I've been shortlisted, which I think that's a good sign. Yeah.
Well done. So would you say that the dementia programme has ignited your
Yes, the dementia
professional
program. Yeah,
development.
it has, because with the appraisal that we do yearly on the stroke unit, because that is one of the things that I do say that I would love to further more and to become a nurse one day, because I've always had that passion, and right from the time, from the onset, I've got the passion to care for people and to look after them and to give the quality care, and also with the opportunity given with the funding for the nursing, I think that's a bold step for me as well to carry out.
Excellent, very good. Thank you, both of you.
Thank you.
Thank you.